Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. Joined today again by Mr. Adam Thacker, who's our Chief Operating Officer of Good Samaritan Hospital. We're going to talk a little bit today about getting everybody up to date on where we stand with COVID-19 in our community and kind of where we're going over the course of the next few weeks or so. A lot has changed in the last 3 to 4 weeks or so. One thing that we'll talk a little bit about today is, since our last big holiday, Memorial Day, we saw a rise or an increase in number of cases that came up, and then that sort of has flattened back out again, so we'll talk a little bit about that. Giving you an updated number on where we're at, kind of statistics in our own community here. We basically have 6 active cases within the community. If you notice on our Indiana State Department of Health website, there's 35 positive cases for Knox County, and we've tested well over 1,100 patients within our system. So the nice thing to see about that is not only are we not seeing a more steady rise and increase in cases, we're just kind of seeing a few trickle of cases come in from time to time. And I think one of the other encouraging things that we've seen within our community is the cases that we have seen have not necessarily been as sick or as ill as what we've seen in the past, which is great.
Yeah, few hospitalizations, which is a really important factor in how virulent the virus is and the resources to take care of individuals. Still 0 deaths in Knox County, which is a great number to be able to report. And as Dr. Stine said, that Memorial Day, we saw about a 30% increase in cases following that in that 10 to 14 days. But we've seen that kind of flatten back off, and we're back to seeing a case or 2 a week as we move forward through the reopening plans now in stage 4.
And clinically, we're seeing less and less patients coming in with other respiratory symptoms as well. Certainly, we're seeing kind of our usual span of things that we see over the summer months, but in terms of respiratory illnesses in general, that has flattened out. That brings up one of the things that I get asked a lot, which is coming back to the doctor, getting back into normal health care is now a good time, and the answer is absolutely. We have really encouraged people, since we have seen the decline in cases over the course of the past few weeks or so. If you need to get back into your physician to have your medicines refilled, check in on your medical conditions, have wellness visits for yourself, your family members, or for your kids, or do sports physicals, now is an ideal time to do that. We fully anticipate that as we kind of march through this and get into our fall and winter months, that we will see an increase in other respiratory illnesses and ultimately concern about resurgence of COVID. And so right now is an ideal time to re-engage with your healthcare individuals. I know there have been a lot of people that have called back to get their appointments rescheduled for procedures. Obviously, we put off a lot of elective procedures, and so patients that, for instance, I maybe saw 3 or 4 months ago for colonoscopy consults are just now coming in to get their procedures done. And that has been the case of a lot of elective procedures that were put off for several months. So a lot of people are coming back in to get that stuff going as well. So we definitely encourage people to re-engage in that, and that kind of brings us to where we are. So we got a little cookie thrown to us again, and we got pushed into stage 4 a little earlier. You want to talk a little bit about those numbers, Adam?
Yeah, so in the initial plan, it was actually to be June 14th, and that got moved up to the 12th. So on Friday, we rolled into stage 4. Social gatherings went from 100 to 250, so that was a big jump. And then we saw many areas that had opened under restriction are able to open at a higher percentage. So you had your shopping centers and malls that now are able to be open at full capacity. Your in-restaurant dining, that was at 50%, goes to 75%. Some of the open seating, bar seating type of atmospheres were allowed to open. We also saw locally resuming of youth sports activities and the like, which was really good to see that happening and get back to the sense of normal. What hasn't changed is good hand hygiene, and just hygiene in general is important, as well as face coverings are still recommended. Social distancing is still recommended. So when we go from the social gatherings of 100 to 250, if you read the full, it's 250 with social distancing. So still trying to maintain that, follow all the safety precautions. If you come to Good Samaritan for services, it'll look a little bit different as far as screening stations. Our visitors are being screened, our patients are being screened as well, and making sure that we're getting everybody with a mask on, so it's mandatory at all Good Samaritan locations that you wear a mask. And then out in the community, you're going to see things that look a little bit different as well, from retail and shopping atmospheres that have put up either plexiglass or are requiring masking or have additional hand hygiene stations, a lot of social distancing signage on the floors and on the walls at different places. So the big ask there is just understand that in entering those locations and be respectful of the activities that really help to keep everyone around us safe.
And we're really seeing that as we have marched through stage 3, stage 4, stage 5, the gaps between those stages is getting a little closer each time, and probably won't be as tangible to see when you're going to places that much has changed. The gathering size has changed, the restrictions on restaurants and bars and so forth has changed, but as we kind of go into stage 5, it's not going to be as much of a tangible change necessarily for that. But we're kind of waiting. The next opening will be on July 4th. We have seen the last couple of stages as we have marched into those that there's been a little early opening as each of those, so we'll stay tuned for that. One of the things that we're eagerly anticipating that we haven't seen yet is the second wave of the Fairbanks School of Public Health study. That was collected over the course of the last weekend, not this previous weekend, but the one before that, and we anticipate that data will be coming out over the course of the next week or so, and that will hopefully give us more information. We got a lot of important things that we learned from the previous study that was performed, and this will continue over the course of the next year or so as that new data is collected, and hopefully give us some additional guidance on kind of where we go from here. I've had a lot of people ask the same question repeatedly as to why the masking. Why do we continue with the masking? It seems like we're getting better and there's less cases and all of these things are better and the death rate is better and we're not seeing as many hospitalizations. Why do we continue with the masking? And it has everything to do with the gradual increase of exposure as we get out into our community. So as we go out, as we do more things, as we have more gatherings, as we get in more social situations, it's basically just trying to reduce that spread right now. And as Adam said, the hallmark and what we will continue to preach as we go throughout this is standard guidelines as far as hand hygiene and masking, and that continues to be important as we go. And then the longer that we are in this more exposed phase, then the more that we'll know about what things are going to be like over the course of the next several months or so. Many people have asked also about vaccine availability and treatment availability. Again, as far as treatment is concerned, we're seeing very, very little activity in terms of use of treatments because the majority of the patients who have the illness recover on their own. In talking with Dr. Stewart and understanding the 6 active patients that we have in our community, they're basically recovering from home. The majority of patients that we've had, 35 over the course of the past 3 months or so, again, we're diagnosed and we're given supportive care and we're recovering at home. So we fully anticipate that as we continue to march through these next several months or so, that hopefully that continues to be the case. Very little additional information as far as vaccine availability. Again, that is a big push towards the end of the year. We certainly hope that becomes available, at least for our higher risk patients as we enter the fall and winter months, but no specific dates or guidance on that until we see as they finish out their clinical trials, which I think a lot of people may understand as a drug is released in phase 1 and phase 2 clinical trials, that process is relatively quick, and then when they get into their final trials, that process slows down considerably.
Right. And safety is paramount in that. So a rush to put out a vaccine that may have side effects and may be more detrimental than the vaccine itself is something that obviously needs to be avoided. So that process does take a number of months and even years. The typical process is a number of years, up to 5, 6, 7 years for a vaccine to be developed, and that's being truncated into the goal and having it out in about a year. But safety remains the paramount piece of that, and that the vaccine works effectively, but also it can be safely administered. One thing that we're learning more and more about coronavirus is that it's acting more and more like many other viruses. Yeah. So as we see the data coming out, it acts like flu and many of the viruses that we see. So that's helpful in our clinical team being able to treat the condition. And as Dr. Stine mentioned, especially in our area locally, we've seen very few cases that have been severely ill and requiring long-term hospitalization, and that's where a lot of the focus for the treatment modalities has been. So it's really supportive care, home management, and rest that we recover here in Vincennes from the majority of the cases that we've seen.
One of the things that you alluded to just a few minutes ago was visitor policy. So that changed over the course of the past week and a half or so. We give people an update on kind of where we are with that as we allow more people to come in with their family members.
Yeah. So those rules are posted on our GSH site. You can click at the top on coronavirus and see the actual breakdown. But as an overview, one visitor are allowed with all of our patients across the organization. So medical office visit, throughout a visit, a visitor can be with the patient. On the inpatient side, one visitor from 10A to 6P can be a visitor, one designated visitor per day. In the surgery atmospheres, procedure-based atmospheres, a visitor can be there at the beginning of the procedure and then with their family member after the procedure, and if they're being admitted, can go up to the floor and stay during the normal visiting hours, or help to what's called a settling in phase, help to get them settled in for their overnight stay if they're going to be an inpatient. Something that we spend a lot of time talking about, because certainly having family around and being able to help with a patient is part of the healing process, and we recognize that. So we're balancing that with keeping traffic down in the hospital where appropriate and as safe as possible. We will continue to evaluate those moving forward. I think it's safe to say that visitor policies and visitor expectations across the nation for hospitals are probably not going to just return to what they were pre-COVID. That's one thing that has likely been a permanent change, but we are continuing to look at that. There will be further relaxing of visitor policies as we move forward, but visitor hours and those types of things are likely here to stay, so we can make sure that the patient as the priority is remaining safe, as well as our staff that are taking care of them.
And one of the challenges, as Adam alluded to, is visitor policies may be different in different organizations and different facilities, even within our own county. One of the things that has changed a bit over the course of the past few weeks or so is the nursing homes have started talking about what their visitor policies are, how they're going to manage that, because of course on day one when things open up, everybody wants to go see their family members.
Right.
It's been a very long time. It's been difficult for a lot of those patients because of isolation. Some of them are in there because of dementia and problems of that sort, which have made it even more difficult for them to manage. And so what we would encourage people to do is be in contact with the administrators of the facility that your family member is in. They will be releasing those guidelines for their specific institution as we march along, and realize that each one of those institutions may have slightly separate policies. So if you have family and friends in other facilities, long-term care or places like that, it may look a little bit different in one facility versus another. So bear with them as they work through those policies. We have been very fortunate in our county that we have not had a big outbreak in any of our facilities, and we hope that continues to be the case. And part of that has been because we had very strict guidelines, and people were very cautious early on to manage patients that were found to be positive in the area, and how patients were coming in and coming out of those facilities. So be patient with those administrators and those facilities as those open up as well. There have been a few policy changes as well as far as testing, and there's some state guidance behind that as well. Is that right, Adam?
Yeah, the state released that in the month of June, all long-term care facility employees will be tested through a state process, statewide. The dates and when that will happen in Knox County and our surrounding counties is not something that we know as of yet, but there's planning and they are working on that. Actually, I have a call tomorrow with Indiana Hospital Association and the State Department of Health, kind of talking about how that will work and where Good Samaritan's role is in assisting with that, and how the testing process, but that'll be happening in the month of June. As Dr. Stine mentioned, with the long-term care facilities opening up for visitation, they did release that outdoor visitation was allowed, but it's a local decision as far as each facility, and that really holds true with all of the reopening. Just because the gatherings are 250 or you can open at 75%, every business owner in every community has to make a decision as to how logistically you implement that, and also how safe they feel it is. So it's not a hard and fast rule that if that's the back on track plan, that's what you have to do. Everybody has to look at that and see how it can be done in the most safe manner for their business or for their organization.
One of the other things that we are asked quite frequently, because this changed over the course of the past week also, is antibody testing became available at our facility. A number of patients contacted me over the course of the past week and said, hey, I'm quite certain that I had this, and I want to get tested. And of those patients that we ordered that on, 0 of them came back positive for antibodies. So I say that tongue-in-cheek to realize that many of us have had a variety of viral illnesses over the course of the past 6 months or so. And it's easy to let your mind go there and think, well, I'm pretty sure that I was case number 1 or case number 15 or so forth. But thankfully, the incidence or the activity of that virus in the fall, even in the early spring months, was very, very low and continues to be low. Our positivity rate here, when you summarized last week, 3%?
3%.
Yeah. So very low as far as that in our community. That being said, antibody testing is now available, and we're offering that through our system.
Correct. So we have antibody testing available, and that testing is happening in-house. So if your provider orders antibody testing, which it does require a provider order, that can be ordered. It is a lab draw, so a venipuncture. It's not a swab or a finger stick. It is a lab
People
draw.
will be probably happy to hear that.
Right. But keep that in mind. And it is about a 1 to 2 day turnaround time to get those results. It's a highly sensitive, highly specific test, which in the testing world, those are the 2 things you want, is a test that is specific and sensitive. It does have the FDA's what's called emergency use authorization, not the full approval, but there's not antibody testing that does because of the rapid pace to get things to market. But it is available, and as Dr. Stine said, we're not seeing an initial number of patients that have gotten it that everybody's positive, and we don't expect to either. The Fairbanks study, when they did the antibody testing, it was a very low percentage. I think it was about 1%, 1.5% of all of the patients that they tested had antibodies that had shown they had previously come in contact with the SARS-CoV-2. So on the antibody testing, what does it mean if you do have a positive? It simply means that you have had COVID-19 and are probably recovered from it. It could mean that you have it and you're still positive for it if you're getting both tests. But the information is one of those that we look at and say that information is going to be more valuable down the road. Right. And what that means down the road. What it does not mean, and I always have to put this plug in, it does not mean instant immunity, and you do not have to follow anything that we've just talked about for the last 20 minutes. We still have to follow all of those because the data doesn't support yet that it's an absolute that you can't shed the virus and ultimately make somebody else ill.
Tiffany, you have anything online for us? Let's go to the phones.
All right, some questions from Facebook. Someone asked, I'd like to ask if people 65 and over or with a compromised immune system should still be social distancing.
Absolutely. The answer is yes, and even more yes than the rest of us. What we are telling people is, again, when we're wearing masks, we're protecting others from ourselves. That being said, the social distancing is still very important. One of the interesting things that has come out from the CDC is this issue of how the virus is spread. And as Adam alluded to earlier, we believe that this is spread like most viruses are spread. And so respiratory droplets, particles of mucus that carry the virus through the air that then get ingested into your system or your mucous membrane seems to be the primary method by which this is transmitted. That being said, it's important to realize that if you do have medical problems and if you have a compromised immune system, you're just at higher risk than other individuals are. Not just of contracting the virus, but then of having more complications as a result of the infection. So that being said, you don't necessarily have to stay at home and socially isolate yourself and not go to the store, but you need to do good hand hygiene, and you need to wear your mask, and you need to social distance. And even if you do go to a family gathering where everybody else feels as though, hey, we're all family here and it's not a problem, you may still need to want a mask as a result of that, because we want to protect yourself and make sure that you're doing your best to not catch the virus in the first place. So yes, it's important, and it's also important to make sure that you get in contact with your medical professionals if you think you develop symptoms. As I said earlier, we're seeing less and less respiratory illnesses right now because that's typical at this time of year. We see some allergy problems and things of that sort, but way less viral infections, hardly any flu, hardly any pneumonia, hardly any bronchitis. And so really we want to be on the lookout for it, but we're going to see less respiratory illnesses anyway. So yes, please follow the standard precautions that we have emphasized for everybody, and then just be in contact with us quickly if you develop symptoms.
I know you talked a little bit about visitation guidelines. Someone asked specifically about OB. Are we looking at allowing, another visitor besides the partner for OB? This person mentions that the delivering moms sometimes need their mom and their partner there.
Sure. Yes, that is being looked at right now. The restrictions are the laboring partner, but it is being looked at every week. We have a team that's looking at visitation and where that makes the most sense. And again, it goes back to that balance of, we want the family dynamic to be able to support the patient in whether that's in OB or surgery or whatever setting that may be, but also just balancing the number of individuals in the hospital and the safety aspect of that. So yes, it's being looked at, but at this time it is one laboring partner.
Now this one, I know you talked a little bit about nursing homes here locally doing a good job. I guess apparently there must be some rumors that the nursing homes have a lot of COVID in them here locally, so I don't know if you want to address that or not.
Sure, we've been very fortunate that the number of cases that we've had in our local nursing facilities here has been very low or zero. Now, outside of our county, there have been a lot of outbreaks and some centers where there have been quite a few cases. And so, obviously, rumors may start from that. But it's important to realize, too, that those facilities have had a very challenging time dealing with the number of patients that they've had. And once they have that in their facility, it's much more difficult to manage. So we're very fortunate we've had a low number of cases here in the county. We're even more fortunate that we've had hardly any outbreaks as far as our production facilities, our nursing facilities, and so forth. But as we were talking about, it's just important to realize that each one of those facilities is going to be developing their own policies. They're working with us, and we have a coalition where we meet with them on a weekly basis with nursing administration to offer up our guidance and help out with them in terms of what policies they're putting in place, how we can help them as far as testing and management of their population as well as their employees. And the state has been helpful in that as well. So just be patient with the facilities because they have done an excellent job, and part of that is because they have been somewhat locked down over the course of the last several months.
What about food service workers here in the county, I guess? Are they required to wear masks? Do we know that?
Food service workers, like out in restaurants?
Yeah, in restaurants and fast food restaurants, those sorts.
I have not seen from the Back on Track plan restrictions that require them to wear a mask. I have, in my own interaction, have seen many of them are, but I haven't seen anything from the state level that has said that that's a mandate that must be followed.
I think many of the places are kind of using their own guidelines, obviously to protect their employee population because they need workers, but I'm not familiar with anything specifically now that says that they have to. That being said, they're working with Dr. Stewart, our local health department, to make sure that they're safe, and that's part of each of their individual plans.
And do you foresee GSH volunteers returning in this current year?
Volunteers as our volunteers that work within GSH or like student volunteers? So I'll answer both. Our volunteer program is ramping back up from our volunteers that come in and work at the gift shop and help with patient transport and some of the record keeping and those activities in the hospital. We look at each area and look at the kind of risk reward of that, and also it's up to the volunteer. So a number of our volunteers may fit into that population that is of higher risk, and certainly trying to be protective of them in that regard, and certainly not a mandated must return type of environment. And then our volunteer programs with student volunteers, those are closed for this year. That decision was made back in May as we were looking at the volunteer programs, and with everything going on, made the decision that we weren't going to open up the summer volunteer program for students this year. And if there's more specifics to that type of question, you can always reach out to our volunteer program through the main hospital number and get more specific information.
Okay, those are all the questions we have today.
Great.
Thank you.
Well, thank you all very much for joining us today. Adam, any additional thoughts?
No, thank you everyone.
We'll see you next week.